When we talk about the PARP trials and the original outcome data, which really led to the FDA indications, those trials were really based on a PFS outcome, and most of the time we had good 2 or 3 years worth of median survival data. We've been getting more and more. While the key trials have really started to report out really up to 5 years. SOLO-1's reporting out longer data, and the nice thing about these more updated reports is that it's really confirming the initial response, showing that there's a true benefit of PARP inhibitors. But the further we go out, obviously that's going to be reconfirm that finding, but we're definitely going in that direction. So in the recent ESMO meeting, and actually some other recent meetings, we've had the opportunity to see some of the longer outcome data of PARP inhibitors and their effect in patients with ovarian cancer. In the SOLO-1 data, we've learned that there continues to be a prolonged benefit in those patients with BRCA mutations treated with olaparib. And that's really compelling, and because it's really showing us that there is a subset of patients with ovarian cancer, with advanced stage ovarian cancer, that are actually treatable. We're seeing this in other patients as well. Now, the slope of the curve, it seems like the most dramatic effect of the PARP inhibitors is within the 2 years that they're on therapy after initial chemotherapy. But we're seeing that the benefit of that exposure is continuing throughout, and we've yet to see the curves fall off from where they're going. We're excited about this data. We've known that PARPs are an important part of the treatment of these patients, and they will continue to be an important part of the treatment of these patients. And while we've got longer term data, we need to get a little bit more, but we're definitely going in the right direction.